If you or someone you know has ever really struggled to catch a breath, maybe from COPD or during an asthma attack, you know that awful tightening feeling in your chest. It's truly scary. But for millions, a little puff from an inhaler can make all the difference in the world. So today, we're going to dive into the brilliant science behind one of those key medicines, ipratropium. Let's get right into it. But here's the real puzzle we're going to solve today. You know, when you take a pill, it kind of goes everywhere in your body, right? It's a systemic thing. So how on earth did scientists design a medicine that when you breathe it in, basically just stays put in your lungs and doesn't go running amok, causing problems elsewhere? That is the secret we're about to unlock. Okay, so first things first, we have to understand the problem we're trying to solve. For people with conditions like COPD and asthma, that fight for air is a very real, very physical battle. The smooth muscles that line your airways, your bronchi, they can get oversensitive and just clamp down. The proper medical term for this is bronchoconstriction, and really it's like trying to breathe through a straw that's getting smaller and smaller. The goal of any good rescue medicine is to stop that squeeze and get those airways to open back up. And that is exactly what ipratropium is built to do. It's what's known as a bronchodilator. That's a class of drugs designed specifically to tell those tightened muscles to just relax, to dilate, or widen the airways, which of course makes it a whole lot easier to breathe. So, what makes this drug so special? I mean, it's not just another inhaler on the shelf. Ipratropium is actually a synthetic version of a much, much older drug called atropine. But, and this is the key, it was re-engineered with one crucial, totally game-changing tweak. Now, to understand that tweak, you've got to know its family name, anticholinergics. I know, it sounds super complicated, but the name itself gives us a massive clue. Anti means against, right? And cholinergic refers to a specific signal in your body. So it's a signal blocker. And we're about to see exactly which signal it's designed to block. And this right here brings us to the heart of the story, that single, incredibly clever chemical tweak that makes ipratropium both so effective and so safe. It all comes down to something called a quaternary ammonium structure. So what was the big change? This is the amazing part. By making one tiny adjustment to the molecule, scientists gave it a permanent positive electrical charge. And while that might sound like some minor detail from chemistry class, that single positive charge changes everything about how this drug acts inside the human body. And this slide really shows the genius behind that design. Just look at the comparison. The old drug, atropine, could easily slip into the bloodstream and even cross into the brain, and that caused all sorts of side effects like confusion or drowsiness. But ipratropium, with its positive charge, it's poorly absorbed. It's almost like it has the wrong security badge. It just can't get past the bouncers to get into the bloodstream or the brain. It's a smart lock designed to only work in the lungs. So the takeaway here is that this one single positive charge gives us 3 huge wins. First, you get localized action. It works right where you spray it. Second, it has poor absorption, so it stays out of your general circulation. And maybe most importantly, because it can't cross that blood-brain barrier, you avoid all those nasty side effects that older drugs could cause. Okay, so we know it stays in the lungs, but how does it actually stop those muscles from squeezing shut? Well, it works by basically intercepting a message. Your nervous system uses a chemical messenger called acetylcholine to tell your airway muscles to contract. You can think of it as the choke signal. The process is actually pretty simple. Imagine the muscle receptor is like a lock on a door. Acetylcholine is the key that normally fits in that lock, and when it turns, it tells the muscle to tighten. Well, ipratropium works by getting there first and basically jamming a piece of gum in the keyhole. The real key, acetylcholine, can't get in, the signal is never received, and so the muscle relaxes. The airway just opens right up. It's that direct. Now that we've kind of geeked out on the elegant science, let's talk about how this all plays out in the real world for patients. You know, what's it actually used for, and what do people need to keep in mind? Its main job, its biggest use, is as a maintenance treatment for COPD, helping people manage their symptoms day to day. It's also a huge player in treating severe asthma attacks, where it's almost always teamed up with another drug called albuterol for a really powerful 1-2 punch. And, a little fun fact, it's even used as a nasal spray to help with a runny nose. So how quickly does it do its job? Pretty fast, actually. After you inhale it, it starts opening up the airways in about 15 minutes. It hits its peak power in about 1 to 2 hours, and you'll generally feel that relief for somewhere between 3 to 6 hours before the effect starts to wear off. Now, because it's so well designed to stay in one place,
The side effects are usually localized and pretty mild, but there is one that is, by far, the most common one people report.
Yep, that's it. Dry mouth. Because the drug blocks the same type of signals that control your salivary glands, a dry mouth is the #1 complaint. Honestly, it's a small price to pay for being able to take a deep, clear breath.
Of course, no medicine is completely without risks. For people with certain conditions like narrow-angle glaucoma or an enlarged prostate, you have to be careful, as the drug can make those symptoms worse. And this is really important. You have to check the specific formulation, because some of them contain something called soy lecithin, which is a big no-no for anyone with a peanut or soy allergy. So as we wrap this up, let's bring it back to that main idea. The big takeaway here isn't that ipratropium is just a strong drug. Its true brilliance is in its precision. It is a perfect example of designing a drug to be smarter, not just stronger. You know, this quote from our source material just says it all perfectly. Creating this molecule was a genuine breakthrough. It proved that you could actually target a therapy to a specific organ, which dramatically improves safety and ultimately makes life so much better for millions of patients. And that leaves us with one final thought to chew on. This idea of a single, clever molecular tweak completely changing a drug's personality, that's a powerful theme in medicine. So what other common medicines that we all rely on owe their success not to brute force, but to a similarly elegant and intelligent bit of chemical design? It's definitely something to think about.